Did you know that the right exercises can reduce knee pain from osteoarthritis better than many medications? If your knees feel stiff or weak, these physical therapy exercises can have a dramatic impact. Knees are more complex than people allude to because it looks like a hinge joint, but it's a little more complex than that. And for the most part, when we're addressing stability of the knee, we don't want to think large primary movers specifically, like the big quad muscles in the thigh. And, we definitely don't want to get into a situation where we're doing heavy squats or things that load the knee joint more so than they need to be. So there are very basic exercises that can really move the needle significantly that most people, maybe aren't aware of. The gold standard look most people are aware of, right? So riding a bike or bicycling is ideal for knees. Not only does it promote range of motion and kind of pass fluid over the joint to kind of get things moving. Range of motion, flexibility, and mobility is extremely important, but it also provides stability in a dynamic activity. So whether you go out and ride a bike for a period of time or you buy an ergometer, which are those little things that sit in front of chairs, and you pedal for a short period of time, or you warm up at the gym on the exercise bike, that is an ideal strategy initially. And that is, in my opinion, probably the gold standard. But there are other exercises that are not as well known that provide a ton of value in the intrinsic stabilization of the knee itself. One is called anterior tib raises. So basically it's with your heels on the ground. You're just lifting your feet, the front of your feet like this while standing, and then holding it for a period of time and then allowing it to kind of go back to the normal place on the floor. And that anterior tib is the front portion of your tibia or the lower leg. And that particular muscle really helps in providing some intrinsic stability that helps with osteoarthritic knee pain. Another one that's really, not very well known, but walking backwards on a treadmill. Many of the first signs of knee pain from arthritis are coming downstairs. And that is a similar motion that essentially can provide some significant stability if you do them often enough. Now, the one thing that I'll tell you is just be careful. Like obviously walking backwards on a treadmill can get a little bit sketchy if your balance isn't good or if you're really deconditioned. So, use your better judgment. They've been doing that in Japan, I think, for, hundreds of years for knee pain, and it works really well. So, for our patients, we have a very specialized knee protocol that we give to all of our patients, whether we treat them or we don't. In the beginning stages where the severity of the arthritis is not so significant that they require intervention, in many cases, those types of exercises can solve that problem for most people. Flexibility is really important for all joints. We want them to move through a full range of motion in order to maintain their health. So if joints are limited in their flexibility, there's going to create some level of dysfunction that will cause some damages over time. So we want to maintain flexibility. Obviously, stretches are probably the most common thing that we think of, but really what's more important is like mobility exercise. So moving through full ranges of motion as often as we possibly can. Movement is by far one of the most important things we can do for our overall health, not just to our physical body, but our brain, our central nervous system, all of the above. So I think people really just need to focus on, taking care of their physical body and making sure that they're doing things on a daily basis to promote normal movement patterns. There are a wide range of things that you can do for knee mobility. Losing flexibility in a knee, it's really difficult to experience. Like what I mean by that is sometimes you don't realize that you've lost flexibility until it's gotten to a point that it's really significant because the knee doesn't really extend very far. It only typically flexes, at least in terms of what we experience. So you're not necessarily aware of the amount of flexibility that you can lose over time until you've lost a significant amount. So I think just, being aware of the fact that we need to move and we need to take care of our joints and our physical body is essential for long-term joint health. We do things backwards in the traditional model. And I don't love to say traditional model as opposed to this model. I think we should all work in collaboration. I think when we have damaged tissue in a joint, we have an osteoarthritic condition, and there is a significant amount of damage. There isn't a whole lot of physical therapy that you can do to overcome that damage. So what we attempt to do is functional activities in the form of physical therapy in the hopes that that's going to solve a structural problem. And in many cases, that tends to fail. And what happens from that perspective is once physical therapy isn't successful, then we move them into a drug or symptom-based model that, again, doesn't lead to any place long-term. Now, the role that physical therapy plays in a regenerative model is very different. So once we've had the capacity or the opportunity to heal tissue, then it's much easier to enter a physical therapy model to achieve the goals that would be necessary to solve the problem long term. So imagine that somebody comes with significant pain, they've been through multiple rounds of physical therapy, maybe they had a cortisone injection, and they have a significant amount of damage. In a regenerative model, our job, very simply, is to repair that damage to the best of our ability, and then over time, once tissue has healed appropriately or to a certain point, now we can really start going in and stabilizing and improving the function of that joint so that once we get pain relief, the patient is better long term. So if you're looking for more resources, please check the link in the description, and if you have any questions, please leave a comment below.